Now, we are fortunate to have Dr. Cecilia Sorensen join us today to talk about medical education. But I just wanted to remind you, going back even further, that some countries have climate change in their primary school system. Italy is just one example where the young children start out learning climate change. Dr. Cecilia Sorensen is a physician investigator in the area of climate change and human health at the University of Colorado School of Public Health and is an emergency medicine physician in Colorado and Alaska. Following residency training at Denver Health, she became the first Living Closer Foundation Fellow in Climate and Health Science Policy in 2017. She is an author for the Fourth National Climate Assessment and serves as a technical advisor for the annual Lancet Climate and Health U.S. Policy Brief. Her academic interests are broad, and she has published research regarding the impacts of climate change on women's health, worker health, wildfires and healthcare utilization, the spread of Zika virus, and mortality following Hurricane Maria in Puerto Rico. She has lectured nationally and internationally on these subjects and is also providing education for public audiences. I just wanted to share a few other items. Now, one of the goals with the Climate and Health Science Policy Fellowship is learning climate science, the most up-to-date science nationally and internationally. So the United States Global Change Research Program and the National Climate Assessment, but also the United Nations Intergovernmental Panel on Climate Change reports. It's also about educating the youngest to the oldest on climate change across diverse audiences. And then thirdly, it's about understanding policy, not only how policy works in different contexts, but how you make change happen and participate as a health professional. Her fellowship uniquely intersects academia, government, non-governmental organizations, and private industries, and has resulted in fantastic efforts that highlight key issues on climate change. This is just one example from a couple years ago on women's health. I highly encourage you to read it further. There's a layout of different health impacts and policy directions that can be taken in different settings. This was another example that came out in August of 2020, the clinical implications of climate change on the United States emergency medicine, challenges and opportunities, with specific focus on vulnerable population and emphasis on 7 key areas, including clinical practice improvements, building resilient emergency departments and healthcare systems, adaptation and public health engagement, disaster preparedness, mitigation, research, and education. In her fellowship, she was a key contributor to a New England Journal of Medicine report, mortality in Puerto Rico after Hurricane Maria. After the hurricane hit, essentially interruptions of medical care was the primary cause of sustained high mortality rates in the months after the hurricane.
Hi everyone, it's great to be here today. So we know that despite escalating impacts from climate change, there remain broad knowledge gaps among clinical and public health professionals, and thus there's a critical need to develop and cultivate new knowledge and skill sets. So today I will be talking about bringing climate education to clinical practice, as well as to the healthcare professions. So my goal is to introduce you to the current landscape of climate and health education, and then focus on examples of how climate and health is currently being incorporated into curricula. Next, we will look at examples of how climate issues are being addressed in clinical practice and healthcare management. And finally, we will discuss challenges and lessons learned. So in a recent survey of National Medical Association physicians in the US, 97% believed that climate change was happening. 88% believed that climate change was causing harm in their communities. 80% believed that climate change affected their patients' health. And most believed that vulnerable populations were being disproportionately affected. However, according to recent studies published by the International Federation of Medical Students, worldwide among 3,000 medical schools in over 100 countries, Only 15% of medical schools currently offer climate and health education in their curriculum, and about 12% have student-led climate-related programs. Furthermore, this survey showed that 40% of medical graduates reported that they felt their education on environmental health was inadequate. So what we see is that there's a large discrepancy between how healthcare professionals are viewing the importance of climate change and how schools are currently responding. However, I would say that there is mounting global effort. So recently, the Global Consortium for Climate and Health Education formed and is based out of Columbia University, and its mission is to support educational efforts. And currently, over 160 schools have joined this consortium, and of those member institutions, 63% of these schools currently offer some type of climate and health curricula. And here we see a map of current offerings at participating schools in the African continent. Now, in terms of how schools are integrating climate and health, we see that there's a large variation. So in this survey of schools, 76% indicated that their institution provided climate and health session as part of one of their required courses. 44% reported offering a climate and health standalone elective course. 39% reported offering a climate and health session as part of a non-required course. What we see is that fewer institutions, only about 7%, have a climate and health doctoral degree, while 4% have climate and health related postdoctoral positions. And then less than 2% reported a climate and health master's degree or certificate. So in this rapidly evolving field, we see that there are many different approaches for success and many different opportunities for engagement. But I think really the larger question is, what do health professionals really need to know, right? So what concepts, skills, and knowledge are essential? So although it's pretty widely recognized that a one-size-fits-all approach to curricular development won't work, several organizations have put forth frameworks, including the Global Consortium of Universities for Climate Health Education. So I want to briefly present these core concepts just to give you an idea of the types of competencies that are being promoted. But keep in mind that not all are meant for all different types of healthcare professionals. Some are more specific to public health schools, some more to medical schools. And this is really just meant as guidance. So category 1 relates to climate and health knowledge and analytic skills, where the goal for students is to be able to demonstrate an understanding of the complex relationships between climate change and health. Category 2 relates to climate change and public health practice, where the goal for students is to demonstrate competence in recognizing population-based hazards and designing and implementing public health interventions. Category 3 relates to climate change and clinical practice, where the goal for students is to demonstrate competence in diagnosing and managing climate-sensitive illnesses. Category 4 relates to policy aspects of climate change and health, where the goal is to demonstrate familiarity with international and domestic policies relevant to climate change and health. And lastly, category 5 relates to communication, where the goal for students is to demonstrate competence on how to communicate climate and health information to different audiences. And so the consortium provides much more detail on these objectives on their website, and I've listed their website here for your reference in case you're interested. And so currently, I would say there's basically 3 main approaches to integrating climate and health into core competencies among medical schools. So these include longitudinal curriculum over the course of a degree, embedding climate and health issues within core systems-based learning, and short intensive courses. So for example, the University of Cape Town is currently building a longitudinal curriculum where climate and health is incorporated into all years of medical training, as well as within the schools of physiology, speech therapy, and occupational therapy. So for example, starting with the first year of medical school, students are introduced to the concept of an environmental history taking. In the second year, students are exposed to case studies on climate change and waterborne disease in their integrated health systems course. In the fourth year, there's a dedicated lecture on climate and health impacts with a focus on vulnerable populations, and so on. The University of Illinois has taken a different approach. They are embedding climate-related health risk assessments into simulated case scenarios involving standardized patients, such as one with pre-existing asthma suffering from a severe exacerbation due to wildfire smoke exposure. The Icahn School of Medicine at Mount Sinai has also integrated climate and health into their existing didactic curriculum. For example, microbiology lectures covering climate-sensitive vector-borne diseases now include material on how warming temperatures affect the spread of tick habitats. And neurology lectures students learn about the links between fossil fuel related air pollutants and neurodegenerative conditions associated with Alzheimer's disease. Similarly, the University of Minnesota has integrated climate and health peer-reviewed slide decks into existing lectures for each of the university's health science programs, including the schools of medicine, dentistry, public health, pharmacy, and dentistry. The University of Colorado has a different approach. They host a dedicated 2-week intensive elective. So students choose to sign up for this during their fourth year of medical school, and they're exposed to core curricula from on-site faculty, as well as numerous remote guest lectures from experts at other academic institutions and federal agency scientists working on climate and health policy. So as part of the elective, students go on field trips, including visits to the National Ice Core Laboratory and to the National Center for Atmospheric Research. They have extensive workshops on communication skills, and they write op-eds focusing on local impacts in their community. And so with this 2-week curriculum, there's really a lot of time to bring students very deep into the topic matter and really explore and develop skill sets. Public health schools are also rapidly evolving curricula. So for example, many schools now offer a distinction to mark proficiency and expertise on the topic within degree programs. Other schools are offering climate and health concentrations, and still others have a master's degree dedicated to the topic. So for example, Kenyatta University in Kenya has a dedicated master's program on environmental studies in climate change and sustainability. The University of Ibadan in Nigeria has a diploma in child health, which explores climate change in its curriculum as a social determinant of health. And the London School of Hygiene and Tropical Medicine currently offers an environmental health track where students explore climate equity and sustainability, climate risk management, and learn to apply principles of sustainable development as well as environmental health policy. And I want to mention that even without dedicated climate and health curricula embedded into degree programs, that institutions can still foster community learning around this topic. And a great way to do that is through grand round lectures and lecture series. And this may be a good way to start generating interest and engagement on campus. Other schools, such as Harvard, Johns Hopkins, and University of Wisconsin, have climate and health courses, which are offered through online learning platforms. And each of these schools offers a certificate program once you complete these courses. And these modules can be a really great way to learn about the topic and to generate ideas for creating your own curriculum. So the next question that needs to be addressed is how to bring climate and health education to practicing healthcare professionals. In the US, as well as internationally, we've seen that professional medical societies have really been leading the way in terms of mobilizing their memberships to have greater awareness of climate and health impacts. So for example, the Nurses Alliance for Healthy Environments has created a project called the Nurses Drawdown Initiative. And what they are doing is engaging members around 5 actionable areas, including energy, food and nutrition, mobility, gender equality, and nature-based solutions. And they provide webinars, they host conferences, and they have a huge suite of online tools to enable members to basically enact practice changes within their own institutions and partake in a lot of independent learning. In the US, the Medical Society Consortium on Climate and Health has also been leading initiatives among medical societies. So they currently have mobilized 29 different societies to come together for the purpose of climate and health. This represents nearly half of all practicing physicians in the US. And what the consortium does is they provide conferences for members and offer CME credit. And they also engage members through online newsletters and materials. Additionally, they are very politically active and they encourage member societies to formally publish policy statements on climate and health and to publish patient-centered communications for provider dissemination. We're also seeing a broader interest and engagement in the topic of climate smart healthcare, which is a movement to basically consider and address how healthcare operations contribute to global carbon emissions. And so although this is slightly removed from day-to-day patient care, this subject really addresses the root causes of climate change through mitigating the global healthcare sector's enormous carbon footprint. While simultaneously, this effort is to address issues of system-wide climate resilience. Now, globally, Healthcare Without Harm, if you've heard of them, has been an international leader in this effort. And basically, they coordinate huge amounts of webinars for providers. They disseminate technical knowledge and information. they coordinate annual conferences, and they maintain a robust membership profile. So this is a really great organization to join and be involved with if you're interested in spearheading an initiative at your own institution. They currently support many member hospitals in the African continent. For example, they've worked with hospitals in Ghana to install autoclaves and other equipment to improve health waste management. And additionally, they've partnered with hospitals in South Africa to invest heavily in alternative water supplies due to impending drought. And so my hope was really just to give you a broad overview of current educational offerings underway. Now, this is a really exciting and growing field. However, there's a lot of challenges given that it's so new. When we've interviewed schools and institutions that have attempted to put forth curriculum, there's been some kind of common themes that come up in terms of barriers. The first one is a lack of available staff time to work on curricula. And so, this is not really a part of a lot of people's academic repertoire. And so staff don't have the time to teach curriculum. People also say that there's a general lack of funding and support for development. And so there really isn't the administrative staff or the budget available to roll out curriculum. We also see that there's a lot of competing institutional priorities and lack of space in the core curriculum. So for example, medical schools always have so much they need to cram into, just a few years in medical education, and everyone's kind of vying for space. So you end up kind of being one more group that's trying to advocate for your cause. Other schools report that they would love to have climate and health curriculum, but they have a lack of staff expertise. So there's no one really on site who can teach it. And other schools say that, there's administrative skepticism about climate health science. And so there's really kind of a lack of support at leadership levels to having climate health curriculum. So despite these barriers, progress really is possible. And we're seeing more and more that institutions are able to offer climate and health types of learning opportunities for their students. And if you're interested in starting this type of thing, some lessons we've learned are this. Initiatives to be successful really require champions or leaders within the institution. And these folks need to go around, to other faculty and gain support, talk to administrators, talk to leadership to get this type of learning into the curriculum. Second, we found that engaging interested students, however possible, for example, by sponsoring student-led groups or offering lectures, can be a really powerful way to create an initial presence on campus. And students tend to be very educated about climate change and are very eager to apply it to their profession. Third, we found it really important that education be context sensitive and be related to the most prevalent illnesses or threats found in the community. And I think that's pretty intuitive. And lastly, we found that starting great is really small, that starting small is really great. So we see that changes often occur in a stepwise fashion. And even, having a lecture here or there, having an interest group, having something small really builds over time, because as I mentioned before, there is an acknowledgement among students and providers that this type of education is critical. So thank you so much for your time, and please feel free to reach out to me if you have any questions.